An increase in vaccinations combined with people previously infected with COVID-19. Both are working together to slow the spread of the disease.
Talking about herd immunity, right? Those words we've been hearing so much about the past year or so. And as KRON 4's Hazik Ben-Youn reports, Seattle has done a great job, but there's one Bay Area city leading the way in California to become the first here to reach that milestone.
There is a lot of talk out there about San Francisco being on pace to be the first city in the United States to reach COVID-19 herd immunity. But what is the data telling the experts?
The data are telling me that we're pretty close. I think that, with 72% of the population, of the total population, with at least one dose, it's all in the right direction, and we're doing better than anyone else.
UCSF epidemiologist Professor George Rutherford points to a key indicator, a dramatic decline in rates of hospitalizations.
I think most recently there were 14 inpatients in all of San Francisco, and 6 of them were from outside of San Francisco. So that's pretty remarkable.
However, Dr. Rutherford cautions while this may be a reason for celebration, he says it is not a pass for anyone thinking that herd immunity means San Franciscans no longer need to get vaccinated.
Yeah, negatory. First of all, these variants keep getting more and more transmissible, which pushes the level we need for herd immunity up higher and higher and higher. If you'd asked me a year ago, I would have said 67%, no questions asked. Now I'm thinking, well, maybe 75, maybe 78, maybe 79, maybe an 82. We're going to have to get it up there. So we need everybody to get vaccinated.
Officials at the San Francisco Department of Public Health agree. They sent us a statement reading in part, quote, although we are encouraged that San Francisco has very high vaccination rates, reaching a certain percentage of people immunized does not signify an end to COVID. There are some populations that continue to be susceptible to the virus, including communities that have lower vaccination rates, as well as those people who are ineligible for vaccines, such as children below 12 years of age. Thus, there is a need for ongoing vaccination efforts and closely tracking COVID cases, unquote. Herd immunity may be one reason to get vaccinated. Dr. Rutherford says self-preservation is another.
Think about this for yourself first. This is a nasty disease that you don't want to get.
Hazik Ben-Youn, KRON 4 News.